Could one small clove of garlic really transform your health or quietly harm it? Every culture praises garlic as medicine, but most people don't know what truly happens when you eat it every single day. In this video, you'll discover how garlic affects your immune system, heart, liver, blood sugar, digestion, even your brain, and the hidden dangers no one talks about. By the end, you'll know exactly how much garlic is safe, how to eat it the right way, and answers to all your burning questions. Let's garlic fix your health now. Before we dive into the changes garlic makes in your body, let's look at what's really inside this humble bulb. Garlic belongs to the allium family, the same family as onions and leeks. But garlic is special because of its unique sulfur compounds. The most famous is allicin. Allicin doesn't exist in whole garlic cloves. It forms only when you crush, chop, or chew garlic. That action activates an enzyme called alliinase, which transforms allicin into allicin, the compound responsible for garlic's strong smell and many of its health benefits. This is why fresh, crushed garlic is more powerful than swallowing a whole clove or cooking it straight away. Along with allicin, garlic contains diallyl disulfide, diallyl trisulfide, and S-allylcysteine. These sulfur compounds have been studied for their effects on immunity, blood pressure, cholesterol, and even the way our cells handle oxidative stress. In simpler terms, they help the body fight inflammation, relax blood vessels, and defend against harmful microbes. But here's something most people don't realize. Allicin is unstable. It breaks down quickly in the body. This means garlic's effects are not the same for everyone. Some people absorb more of these compounds. Others see only modest benefits. Also, heat destroys allicin if you cook garlic too soon after chopping it. That's why many experts recommend crushing garlic and letting it sit for 10 minutes before cooking. This gives allicin time to form. So in short, garlic is like a tiny chemical factory. Break it open, and powerful compounds are released, changing how your body functions at multiple levels. And now, let's explore what those changes look like, starting with your immune system. 1. Immune and antimicrobial benefits. One of the first things garlic is famous for is strengthening the immune system. For centuries, it has been called nature's antibiotic. But how much of this reputation is true? Garlic's sulfur compounds, especially allicin, have strong antimicrobial effects. In laboratory studies, they can stop bacteria, fungi, and even some viruses from multiplying. This means garlic may help your body fight infections more effectively. That's why, traditionally, people used garlic for colds, flu, and even wound healing. Modern studies back this up to some extent. For example, a trial found that people who took garlic supplements caught fewer colds and recovered faster compared to those who didn't. Other research shows garlic extracts may reduce the severity of common infections. The idea is that allicin not only fights microbes directly, but also stimulates certain immune cells to work harder, giving you stronger defense lines. But here's the key. Garlic is not a miracle shield. Eating a clove won't guarantee you'll never get sick. What it may do is reduce your chances slightly or shorten the time you're unwell. Think of it as a helpful teammate for your immune system, not the entire defense army. It's also important to note that the benefits are dose-dependent. One small clove once a week is unlikely to make much difference. Regular intake, whether through daily cooking, fresh garlic, or a controlled supplement, seems to matter most. And even then, garlic works best alongside other healthy habits: balanced diet, exercise, sleep, and vaccines. So while garlic has earned its place as an immune-boosting food, it should be seen as part of a bigger picture, not a magic bullet. Still, it's impressive that something so small can support your body's natural defenses. Next, let's see how garlic impacts something that concerns millions of people worldwide: your heart and blood vessels. 2. Cardiovascular benefits. Garlic doesn't just fight germs. It can also affect your heart and blood vessels in powerful ways. In fact, some researchers call garlic nature's heart medicine. But how much of that is fact? And how much is hype? First, let's talk about blood pressure. Several studies have shown that garlic can modestly lower blood pressure, especially in people with hypertension. The effect isn't as strong as prescription medication, but it's measurable. This is because garlic helps your blood vessels relax by boosting nitric oxide, a natural chemical that widens arteries and reduces strain on the heart. Second, garlic may improve cholesterol levels. Some trials show it can reduce total cholesterol and LDL, the so-called bad cholesterol, by around 10% when taken consistently. It also appears to raise HDL, the good cholesterol, which helps clean excess fats from the bloodstream. That combination can lower long-term risk of clogged arteries. Third, garlic influences blood clotting. Compounds in garlic act as natural blood thinners by reducing platelet aggregation. This means blood cells are less likely to clump and form dangerous clots that can trigger heart attacks or strokes. This property is a double-edged sword. Good for protection, but risky for people on blood-thinning medication or before surgery. We'll cover this risk in detail later. It's worth mentioning that results are not always consistent. Some studies find a strong effect, while others show only small improvements. Why? It may come down to how the garlic is prepared, the dose, and each person's unique biology. Fresh garlic, aged garlic extract, and supplements all behave slightly differently. Still, overall, the evidence points in one direction. Garlic supports cardiovascular health. It may not replace medical treatment, but as part of your daily diet, it could give your heart a helping hand. Next, let's explore another area where garlic seems to play a role: your metabolism and blood sugar control. 3. Metabolic and blood sugar effects. Beyond the heart, garlic also has interesting effects on your metabolism, especially when it comes to blood sugar. For people with prediabetes or type 2 diabetes, this is an area worth paying attention to. Studies suggest that garlic may help lower fasting blood glucose levels and improve insulin sensitivity. In plain terms, it can make your body respond better to insulin, the hormone that moves sugar out of your blood and into your cells for energy. This effect is thought to come from garlic's antioxidant and anti-inflammatory compounds, which reduce stress on the pancreas and help balance hormone function. Some trials have shown that people who took garlic regularly experienced modest drops in blood sugar and improvements in HbA1c, which measures long-term glucose control. While these reductions aren't dramatic, they can add up over time, especially when combined with healthy diet choices and exercise. It's important to note that garlic doesn't replace diabetes medication. Instead, think of it as a natural support. If you already take drugs like metformin or insulin, garlic may work alongside them, but you should always check with your doctor before combining treatments, since garlic also affects blood pressure and clotting. For those without diabetes, garlic may still play a role in maintaining stable energy levels and preventing insulin resistance as you age. This makes it not only a food for treatment, but also for prevention. In short, garlic isn't a cure, but it may help your body keep blood sugar in check and reduce stress on your metabolism. And now, let's look at how garlic interacts with one of your body's most important detox systems, your liver. 4. Detox. Liver health and heavy metal protection. One of garlic's hidden superpowers is its effect on detoxification and liver health. Think of your liver as the body's main cleaning crew. It filters toxins, chemicals, and waste every single day. Garlic gives this cleanup team an extra set of hands. First, garlic's sulfur compounds boost the production of glutathione, a master antioxidant that helps the liver neutralize harmful substances. In simple terms, garlic makes your liver work smarter and stronger whenever you add it to your meals. Second, garlic may actually protect against heavy metal toxicity. In one fascinating study, factory workers exposed to dangerous levels of lead took garlic supplements, and the results were astonishing. Their blood lead levels dropped, and troubling symptoms like headaches and high blood pressure improved. Garlic acted almost like a natural chelator, binding to toxins and helping the body flush them out. Third, garlic shows promise for fatty liver disease, a growing problem worldwide. Research suggests garlic can lower liver enzymes, reduce fat accumulation, and calm liver inflammation. That means long-term liver protection just from a simple dietary addition. But here's the truth: garlic alone won't save your liver. The fundamentals still matter: avoiding heavy drinking, eating balanced meals, staying active, and limiting processed foods. Garlic is the boost, not the magic button. So the next time you hear claims that garlic detoxes the body, remember, your liver already does the heavy lifting. Garlic simply lends it an extra hand when it's needed most. Next, let's travel deeper into the digestive system to uncover how garlic shapes your gut and the trillions of microbes living there. 5. Gut health and microbiome effects. Your gut is home to trillions of microbes, tiny organisms that influence everything from digestion and immunity to even your mood. Garlic interacts with this inner ecosystem in fascinating ways. First, garlic works as a prebiotic. That means it feeds the good bacteria living in your intestines. When these microbes thrive, they produce short-chain fatty acids, powerful compounds that strengthen your gut lining, reduce inflammation, and boost nutrient absorption. In short, garlic helps the good guys multiply, while keeping harmful microbes in check. Second, studies show that diets rich in garlic can increase gut diversity. And gut diversity is a big deal. It's linked to smoother digestion, stronger immunity, and a lower risk of chronic disease. Imagine something as simple as garlic shaping a healthier, more resilient gut environment. But here's the twist. Garlic is also high in FODMAPs, fermentable carbs that can cause problems for some people. If you have conditions like IBS or SIBO, eating raw garlic may trigger bloating, cramps, or gas. For sensitive stomachs, cooked garlic is usually much easier to handle, since heat breaks down some of those tough compounds. So in the end, garlic can be both a friend and a challenge for digestion. For most people, it nourishes good bacteria and supports gut health. But if your gut is sensitive, the how you eat garlic, raw or cooked, small amounts or large, can make all the difference. Next, let's go beyond the gut and ask a bigger question. 6. Bone, cancer, brain, and aging effects. Garlic's influence doesn't stop with the heart, liver, or gut. Researchers have explored its impact on bones, cancer risk, brain health, and even the aging process itself. Let's uncover what the science actually shows. Bone health. Garlic's antioxidants and sulfur compounds may reduce the inflammation that weakens bones over time. Some studies even suggest garlic supplementation can increase estrogen levels in postmenopausal women, helping slow down bone loss. Garlic won't replace calcium or vitamin D, but it may play a quiet supporting role in keeping bones stronger for longer. Cancer prevention. Garlic has long been studied for its possible role in lowering the risk of certain cancers, especially of the stomach and colon. Observational studies often show that people with garlic-rich diets tend to have lower cancer rates. Why? Garlic compounds may block carcinogens before they activate, slow the growth of abnormal cells, and even trigger natural cell death in damaged tissues. But here's the catch. Large clinical trials have been mixed. Some show real benefits, while others don't. The truth is, garlic may help reduce risk, but it's not a guarantee. Think of it as one piece of the prevention puzzle, not a cure. Brain and aging. Garlic's antioxidants, like S-allicin, may protect brain cells from oxidative stress and chronic inflammation, two drivers of memory decline and neurodegenerative disease. Animal studies show garlic extracts can improve memory and learning. In humans, the evidence is still early, but promising. Regular garlic intake could be a natural ally in maintaining sharper thinking as we age. Anti-aging potential. By lowering oxidative stress, supporting circulation, and enhancing detox, garlic may help slow some processes linked to aging. It won't stop time, but it may give your body extra resilience against the wear and tear of life. So, garlic touches nearly every system: bones, brain, and even long-term cancer risk. But not every effect is positive. Next, let's face the other side of the story: the risks, side effects, and times when garlic might actually harm your health. 7. Risks, side effects, and contraindications. So far, garlic might sound like a wonder food, but here's the truth. If used carelessly, it can just as easily cause harm. Ignoring this part can turn a health booster into a health problem. First, odor. Garlic's sulfur compounds enter your bloodstream and exit through your lungs and skin. The result? Strong breath and body odor. Harmless, yes, but definitely uncomfortable in social settings. Second, digestive distress. Raw garlic is powerful and high in FODMAPs. For those with irritable bowel syndrome or sensitive stomachs, it can cause bloating, cramps, gas, or even diarrhea. Cooking usually softens these effects, but some people remain sensitive no matter what. Third, allergic reactions. Handling raw cloves can irritate the skin, and in rare cases, garlic allergy may trigger rashes, swelling, or even breathing difficulties. Fourth, bleeding risk. Garlic acts like a mild blood thinner. It stops platelets from clumping together. This can lower clot risk, but becomes dangerous if you're already on medications like warfarin, aspirin, or clopidogrel. It also raises bleeding risk during surgery. Doctors often recommend stopping garlic supplements at least a week before any operation. Fifth, drug interactions. Beyond blood thinners, garlic may interfere with certain HIV medications, blood pressure drugs, and diabetes medicines, changing how they work inside the body. Always check with your doctor before mixing garlic supplements with prescriptions. And finally, overconsumption. More isn't always better. Eating more than 3 to 4 raw cloves daily can lead to vomiting, heartburn, or, in rare cases, liver problems. Moderation is key. So while garlic brings powerful benefits, it's not safe for everyone in every situation. The real secret is knowing when to use it and when to step back. Up next, let's explore how to prepare and eat garlic so you maximize its health benefits while minimizing the risks. 8. How to eat garlic for maximum benefit. If you want garlic's benefits without the downsides, how you eat it matters just as much as how much you eat. Let's break it down. First, the form. Raw garlic delivers the highest allicin content, the compound most linked to garlic's healing power, but it's also the harshest on your stomach. Cooked garlic loses some potency, yet it's far gentler and still provides valuable sulfur compounds. Aged garlic extract, usually sold as a supplement, contains different compounds that are less smelly and may support heart health and immunity. Each form has strengths and weaknesses, but all can play a role in boosting your health. Second, preparation. If you want to preserve allicin, here's the trick. Crush or chop the garlic and let it sit for about 10 minutes before cooking. That waiting time allows the enzyme alliinase to finish creating allicin. If you toss garlic straight into a hot pan, much of its active power is destroyed instantly. Third, dosage. Most experts agree on about 1 to 2 cloves per day, or the equivalent in supplement form, as safe and effective. That's enough to support health without overwhelming your system. More than 3 to 4 raw cloves daily can lead to stomach upset or even bleeding issues, especially for sensitive individuals. Finally, the best way to consume it. Garlic absorbs better when paired with healthy fats, like olive oil. Mixing it into soups, stir-fries, or salad dressings makes it easier to tolerate. And if odor is a concern, chew parsley, sip milk, or consider aged garlic extract to reduce the smell. In short, the secret isn't just eating garlic, it's eating it the right way. Next, let's clear up the most common questions people still have about garlic, so you walk away with zero doubts. 9. Frequently asked questions. By now, you've seen how garlic can touch nearly every system in your body. But most people still have specific questions. Let's clear them up one by one. Question 1. Is garlic a miracle cure? No. Garlic supports your health, but it doesn't replace medical treatment. Think of it as part of an overall healthy lifestyle, not a magic bullet. Question 2. How many cloves are safe per day? For most people, 1 to 2 cloves daily is safe. More than 3 to 4 raw cloves may cause heartburn, stomach upset, or increase bleeding risks. Question 3. What's better, raw garlic, cooked garlic, or supplements? Raw garlic has the most allicin, but can be harsh on your stomach. Cooked garlic is gentler, but less potent. Aged garlic extract is odorless, still beneficial, and may support heart health. The best choice depends on your tolerance and health goals. Question 4. How can I reduce garlic breath? Chew fresh parsley or mint, drink milk, or pair garlic with lemon. Aged garlic supplements are another option with minimal odor. Question 5. Can people with acid reflux, IBS, or ulcers eat garlic? Caution is key. Raw garlic often makes these conditions worse. Cooked or aged forms are usually easier to tolerate. Question 6. Does garlic interact with medications? Yes. Garlic can amplify the effects of blood thinners, blood pressure medications, and diabetes drugs. If you take prescriptions, always consult your doctor before using garlic supplements. Question 7. Can pregnant women or children eat garlic daily? Small amounts in food are generally safe, but large doses or supplements should only be used under medical guidance. Question 8. How long before I notice benefits? It depends. Some people see changes in blood pressure or energy in just weeks. For deeper effects, it may take months of consistent use. Question 9. Does garlic fight cancer or Alzheimer's disease? The evidence is promising, but not conclusive. Garlic may reduce some risk factors, but it's not a guaranteed prevention or cure. So, those are the most common questions, answered with clarity and evidence. Now let's finish with a balanced verdict and a final takeaway on garlic's place in your health journey. So, what really happens when you eat garlic every day? The answer is balance. On the positive side, garlic supports your immune system, protects your heart, helps regulate blood sugar, nourishes your gut, and may even slow some effects of aging. But on the other side, too much garlic can upset your stomach, cause strong odor, and increase bleeding risk if you're on certain medications. The safest path is moderation. About 1 to 2 cloves a day, prepared the right way. Crush it, let it rest before cooking, or choose aged garlic extract if you prefer supplements. And always talk to your doctor if you're on medication or have digestive issues. So yes, garlic is powerful, but it's not magic. Think of it as one tool in your health toolbox, alongside good nutrition, exercise, and sleep. Now I'd love to hear from you. Do you eat garlic daily? And have you noticed any changes? Share your experience in the comments below.